Let me give you a brief case study. And this case, a person who had been diagnosed with Alzheimer's is in the mild to moderate stage. So this is someone who is really, if you will, with it in a very obvious way. So this is a woman who was really quite accomplished in her life. At the time, she was 80. I knew her, she was 81. She was aware of her problems recalling information. She did activities of daily living without assistance. Her speech was fluent. She had a really great, engaging personality. She was taking Aricept and imipramine for depression. Why was she depressed? Well, of course, there was the problems that she had with her memory, and she said, my brain doesn't work the way it used to. But she also had been living in New England for most of her life, and after her husband died, her daughter realized, and with the help of friends, that she was seemingly confused about things and couldn't live in the big house by herself. So she was moved to this area to live with her daughter. Now, her daughter was well-meaning in every way and was a lovely person. But her daughter also interpreted what her mother did through the narrative of defect and pathology. So I'll give you a couple of examples. She said, my mother has no attention span. Well, why do you say that? I mean, it's really important to know that, but it's also important to know why. And so why do you say your mother has no attention span? She said, well, if my mother went to the refrigerator and looked inside and saw what was not there or what we needed more of, she wouldn't be able to go to the grocery store and buy those things. Ladies, gentlemen, when you look in your refrigerator or in your cupboards and you see that there are certain things that you need to buy more of, what do? Make a list. And why do you make a list? Because if you don't, you'll forget what you need. So this lovely daughter was asking of her mother something that she doesn't even ask of herself, and that she would do exactly the same thing. She also said that her mother has a problem with the concept of time. Well, why do you say that? Well, in about 6 weeks, we're going to be going to a wedding, and my mother is agitating to get a dress. Now, I go to weddings from time to time, and when I go to a wedding, I always wear my blue suit or my black suit. I don't remember the last time I went out and bought a new suit for a wedding. Actually, it was my own wedding. But, ladies, do you often wear the same dress to the wedding? No. And what do you have to do when you know a wedding is coming up? Shop. Now, when I go shopping for something, my shopping is a surgical strike. I need to buy a pair of shoes. I go to Nordstrom or wherever, and I buy the shoes, and I go home. My wife, on the other hand, doesn't do surgical strikes. Shopping is an adventure. And so you can see other things. And, well, anyway, so you find a dress, finally, and maybe it has to be altered. And maybe how long is that going to take? So 6 weeks might not be enough time. So her mother was agitating because she wanted to go shopping because she has no concept of time. Her mother was being proactive, if anything, which means she had really good frontal lobe function, which means that she was doing something that any person who was really wanting to plan ahead well would do. And yet, that was being pathologized by her daughter innocently. So you see how easy it is to take something normal and make it into pathology. So now the thing about Mrs. E in this case, the woman in question, was that her social identity was different in different places, and how she acted was different in different places. The way her daughter was with her at home, and the way, and sometimes hired an aide to be with her at home, the dynamics there were incredible. So one day, for example, Mrs. E shows up at the day center, and she's wearing khaki trousers, and she always had really nice, pressed, crisp khaki trousers, really nice blouse, and a scarf. And she said to me, "It's a good thing my daughter was sick today, and she didn't see me leaving the house, because if she had seen me leaving, she would have said, 'Mother, you go right upstairs and put on something presentable. Now, she looked fine. But she was being infantilized in that respect by her daughter. The people, the aides who came to the house were supposed to be companions. And Mrs. E would say, let's go take a walk. And the aide would say, no. And Mrs. E said, come on, we'll take. And the aide said, I'm in charge here, not you. You're the patient. And here she is, the lady of the house, being denied that role. You see how she needs the cooperation of someone else to be that, right? So in her own home, she's being treated in this very, very pathological way, if you will. But at the day center, the situation was altogether different. And it was much more in line with who she was. Because who was she, after all? Who was this lady? When I met her, and when my students met her at the day center, she immediately started introducing herself in terms of all of the things that she felt proud about. One of which was not being a participant at the day center. We learned, and this is very interesting, she told me this at first, she said that she flew bomber-type aircraft in World War II. She drove a locomotive in her hometown. She was a law enforcement officer in her hometown. I heard all of this stuff, right? Now, my students did too. And she must have picked up, people with Alzheimer's at various stages of the disease have something intact. One of the things they have intact is called social cognition, meaning that they can read the facial expressions of people, just like you can. If you said to me, hey, how are you feeling today? And suppose I said, oh, I'm doing just great. You'd know that I was saying non-verbally something that contradicted what I said verbally. Mrs. E could figure this out, so she's telling my students, oh, she flew bomber-type aircraft in World War II, and here she is at this day center. They know she's diagnosed, and so they were probably, and they expressed to me that they were wondering about this, and so they probably had some sort of incredulous look on their face. The next week, when these students came back, Mrs. E had photographs of herself in uniform in World War II, standing by the plane she flew, and sitting in the locomotive, waving, and in her uniform as a police officer in her hometown. The point I'm trying to make about this lady is that she was a person of great substance, and she was somebody who lived a very, very interesting and varied life, and who was someone, indeed, someone who would earn our respect and admiration, in addition to having raised 4 children and traveling around the world with her executive husband and all of that. So this is somebody who was being limited at home to a patient who was being managed, but at the day center, all of a sudden she has the opportunity to be someone else because she's being cooperated with by the staff. And the students are doing the same. So she becomes a counselor in certain ways to students. Older people have a lot to offer. I say that without any hint of my age, but we actually do. And the fact is that she did as well. And so students would come to her. There were seniors, and, well, I'm not sure I should go. I'm afraid I won't get into this highfalutin graduate school. And she's telling, you don't have to worry about going to some big shot. You can go to any, you'll do great in any school, and I'll tell you why. And she starts telling them why. This is a person who was able to counsel young people in ways that I would have. And she was able to help other people in the program as well. So there were people, they had these programs where they would do essentially coloring. And so one of the women at the table she was sitting at was having trouble coloring within the lines. And Mrs. E is saying, oh, and the woman who was having trouble was really evincing a lot of annoyance at herself. And saying, I can't. And Mrs. E said, you don't have to worry about staying within the lines. You should go outside the lines. They even have a book like Drawing Outside the Lines. It's a really great thing. It could be creative. She was seeing somebody who was feeling bad and was coming to her aid and helping her to feel better about what she was and who she was. And this is a person who became able, she was enabled by the staff to give of herself in ways she always had before. And that really gave her a great deal of self-worth, feelings of self-worth and pride. And she resonated with that stuff. And so it's really important that we understand that the social and psychological predicaments that people with Alzheimer's are facing are very, very real, and they can be ameliorated without any huge amount of money and drugs. They can be ameliorated with training and education and sensitivity and just getting people to treat people as people. One of my former students in the class that I was teaching said, well, what you're talking about really is treating people with common courtesy. And I said, yeah, exactly. It's about common courtesy. You don't talk about people in front of them if you're saying bad things. Well, they'll never remember anyway. Well, they will, by the way, but even if they didn't, what's the difference? Why would you do that? Why would you do that? What does it say about you when you do that? So you all have to take the message to those people who hold the purse strings around here that the solutions to problems that surround people and families who have Alzheimer's is not all about tablets and injections. It's about training people and giving them an education as to how to empathize, sympathize, and respond socially in ways that are facilitative. So we have to start validating people's positive attributes. We have to treat people as if they have those attributes. Stop talking about people as if they're just patients. Recall that the long-standing dispositions people have are still with them, that they last. You can tell. The professor of sociology was talking to me one day, and I said, she was fumbling for some words here and there, but I've worked with her and figured this out. And I said, look, anybody could see that you're an academic person. It's very clear. And she said, well, but there aren't very many yous and people with whom I would open myself this way. And that requires trust. And so those dispositions that are still there have to be engaged. General Yu's wife went to visit him every day at this nursing home. And one of the people at the residents at the nursing home was a former Georgetown University law school professor who never said a word. She would say good morning, and she told me, he's sitting there, he's a professor, he doesn't say a word. I try to talk, he doesn't say a word. I said he was a professor? I said, why don't you say good morning, professor? So she did. One morning, another morning. Good morning, professor. And one day he looked at her and said, may I give you a hug? It was the first word that he ever spoke to her. And she said, if I had won the lottery, I wouldn't have been happier than hearing that guy say those words to me. But she was recognizing who he was. A person I knew at the Adult Day Center was Henry, his name was, and Henry was from New York City, from Brooklyn. He had been an attorney, and any time you heard him speak, especially when he would ask a question, you could hear the prosecutorial aspect of his way of being. And he's being introduced by the director of the center to someone else, and the director says to someone else, this is Henry. Henry was a lawyer. Henry's standing right there. Henry says, I am a lawyer. Well, he hadn't been disbarred, but he wasn't practicing, but he was still an attorney. And you have to respect that about a person. You have to treat that person as if he was, because he is. And so those old dispositions that people have are with them always. If somebody comes to me in some nursing home someday and says, you haven't finished eating your spinach, I'm going to tell that person to stick it where the moon don't shine. And I'm going to tell them, and by the way, if you call me obstreperous for that, I'll tell you to stick that where the moon don't shine too. Because I don't want to be spoken to that way. How dare you? So we have to understand not only that person's dispositions remain intact for a very, very long period of time, but also what is the context in which people do what they do. If Mr. D had told a physician that his wife was irrationally hostile, I don't know what the physician would have said. I would have been relieved if a physician would say, well, what happened? But Mr. D would say, well, I was just doing it. I didn't do anything. He might even describe the whole situation. But suppose he doesn't describe the whole, all of a sudden she's getting medicated. So we have to understand the larger context in which people are behaving. And we have to recognize that the diagnosis of a person should not drive our understanding of who that person is and who that person can be. Because a person is a person. And whatever we do is a reflection of who we are. So the ultimate test is how we act and what we do and what we insist upon from our elected officials and what we can do to make life better right now. If a cure were discovered tomorrow, that's something that's either prevented it from occurring or stopped its progression in its tracks, there would be millions and millions of people with brain damage who need help. What are we going to do about them? And that's why I'm speaking to you tonight, and that's why I thank you very much for your attention. Thank you.